Okay, I know we're gonna be quiet because she's sleeping.
There's baby sleeping
There's a
over
baby sleeping
right next to us.
Yeah.
We wanted to say, hey, we're doing another Wednesday Wellness, and today we're with the pediatric dentist of West Michigan. So we're with Dr. Katie and Dr. Stephanie. We're going to answer a bunch of questions, and we wanted to set up in front of the super cool mural that they have behind us.
They have the case office.
We're going to switch them spots.
Yeah,
so
and we'll ask questions all about the tongue ties.
Yeah.
Everyone wants to know about.
So,
All
we'll
right.
see us later. Go, 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 go.
Hi everyone, I'm Dr. Katie.
I'm Dr. Stephanie.
The ladies.
This is Anna.
We have baby Anna as our special guest.
Okay, so you guys are pediatric dentists. Tell us just the difference of that first.
Yeah, so as a pediatric dentist, we actually go through extensive extra training beyond dental school. So we actually train at a children's hospital, sometimes in conjunction with the university. Like Dr. Stephanie trained at the University of Michigan. We both went to the University of Michigan for dental school as well. I also trained at the University of Pennsylvania and the Children's Hospital associated with that as well. So we go through 2 to 3 extra years of residency training where we're only treating children. We learn not only why a child's mouth and their teeth are so different, but also why treating a child is so different from treating an adult. So we are very specially trained on the behavior enhancement and psychology part of treating children from infancy and birth through teenage years.
I could even tell that just sitting in your waiting room, just how they're like, oh, this kid, we had a weighted blanket on him, or just sort of things.
A lot of the additional training is, related to behavior, development, psychology, but, like Dr. Katie said, some of it's anatomy, just different treatment planning. We see a lot of trauma cases, working in a children's hospital, a level 1 trauma center. So we have a lot of additional time, taking call, doing trauma cases, so really a pediatric dentist is who you want to see if your child has, trauma. You don't think about things like that necessarily until it happens, but just a lot of, and again, some of it is clinical experience, a lot of it's also didactic literature review, because we also have like an additional board certification. To be a pediatric dentist, just like with another specialist, if you were an oral surgeon or an endodontist or something.
So it's a lot different, actually.
Yeah, so quite a bit,
A lot more schooling, a lot more certification and training, because children have so many other things that you want to be sure you're aware of, and as a general dentist or a family dentist, that's what you're considered as when you graduate dental school. There's so much you still don't know about kids and treating kids' teeth. It's almost like a you don't know what you don't know situation.
Like with medicine too. I think we're all pretty familiar with the medical world where, if you have a neurology problem, you see a neurologist. If you have cancer, you're seeing an oncologist, and depending what type, you might even see somebody more specialized. So, a lot of people don't realize that dentistry has specialties too. And I think more and more people are becoming familiar with that.
Yeah.
I think it's less known, especially when it comes to pediatric dentistry, I think, specifically, but.
And you can compare it similarly to taking your child to a pediatrician. They've also done a residency after medical school to specialize in just treating kids. We do the exact same thing. And we actually do residency and train with the pediatricians.
Well, and a lot of that too is, we see a lot of kids with special healthcare needs, and a lot of kids have health issues, or behavior issues. But their teeth in their mouth, just like any other part of their body, is going to be affected, and that's, I think more and more people are understanding now too, the mouth is part of the body, and your oral health does impact and affect your overall health. And so a lot of kids with some of these other special healthcare conditions really do need specialized care from a specialist who knows about their medical condition and has had extra training on all of those, special healthcare needs too. Because you do approach the child differently, but also their medical history in a different way too.
Yeah, anywhere from, a sensory disorder like autism, to a cardiac condition like tetralogy of flow, or a kid with Down syndrome, even in addition, they often have cardiac issues as well.
And on that point too, which I think is important, we have privileges to do whether it's an oral sedation in the office or general anesthesia or IV sedation in the office or at Helen DeVos Children's Hospital. A lot of these kids need treatment under sedation or general anesthesia, which is a different behavior management technique.
Right.
For sure.
But you know, a general dentist does not have the ability or the
Right.
certification to do that or that training. You know,
Right.
so those are things too
To
we
do it
were learning
safely.
in those residency programs, getting additional
Yeah.
training on and experience in, but also because of the additional board certification we do have the ability. And so that's why we see a lot of kids from, you know, all over the state of Michigan too,
Right.
because they do need to see a specialist for those reasons too.
Wow. That's awesome.
Yeah.
Okay, can we talk about tongue ties a minute?
Yeah.
I mean, you ladies
Let's
are
do
awesome. You do it all.
Yeah.
No, I
We
keep
see a lot of
talking.
people. We see a lot of babies and moms with tongue ties who have a lot of questions.
Yes.
Yeah.
So maybe explain, like, okay, so if a patient came to us and was like, oh my gosh, does my baby have a tongue tie? I'm usually like, I don't know, go here.
Yeah.
I'm usually like, yeah, it looks like it to me, but here go.
Yeah.
I always tell them,
But
come
we're
here.
not the
That's what's
experts in
cool.
it,
Like
yeah.
a lot of times, you guys end up seeing babies who may be having like feeding challenges,
Yeah.
or they're really gassy,
Yep.
you know, having trouble with bowel movements, or they're like really tense and tight. Maybe they have kind of a side preference, like tendency with torticollis.
Yep.
You know, so you're kind of sometimes that first line who's actually seeing this patient who is having certain conditions and signs and symptoms associated with oral restrictions, like a tongue tie. You know, there's also a possibility of a lip tie or even buccal ties or cheek ties. But with a tongue tie, it causes so many things. But for an infant, initially it's that tongue is restricted. It's not moving very well. A lot of times babies can still stick their tongue out, but what we're actually concerned about with the tongue tie is the elevation of the tongue to the palate. So sometimes they'll have like a really high palate, but that tension under the tongue causes tension in the floor of the mouth, causes tension in the neck, the shoulders, and back, which is why a lot of times, you know, they have a side preference. They're really tight, you know, sometimes they're a little bit more fussy. You know, we are learning more about tongue ties and how it affects the central nervous system and a baby's ability to actually relax, because a tongue's position resting on the palate is so important for actually your central nervous system development and your peripheral nervous system development, and how it's all connected and allowing that baby to function normally. But in addition, that tongue tie and its position on the palate and how it's strong that tongue is can really impact how that baby is feeding. So, you know, there's so many symptoms associated with a tongue tie when you're nursing. You know, sometimes babies have trouble latching, or mom is having a really painful latch, like bruised, pinched, bleeding nipples, babies popping off the nipple a lot, mom has persistent clogged ducts and mastitis, callousing or bruising of the lips, not bruising, but callousing or blistering of the lips. Baby's very gassy and uncomfortable. It's hard for them to sleep. You know, parents are often very sleep deprived, and you know, the baby will only sleep if they are holding them constantly. So, you know, really, there's so many elements of problems a tongue tie can cause, in addition to a baby gaining weight normally, having a lot of gassy symptoms or reflux. A lot of times babies are colicky or have a lot of reflux. But lo and behold, they actually have a very significant tongue tie. And they're
sometimes even if it's not super significant, it can, you know, impact that. I think that's something.
So I think a lot
every baby's different, right? And every mom's
baby's so different.
anatomy is different too.
Yeah.
So sometimes it is a minor thing, or maybe it's more severe, but the baby is doing okay. So honestly, I really do feel like, you know, if a parent has a question about it or thinks maybe, you know, something's going on, or you know, another healthcare provider potentially thinks there's something going on, it really is best just to have it evaluated.
That's what I always say.
There's just a huge benefit. There's no harm associated.
We know it's a
with
huge
doing
change
the
in the babies
procedure.
when they come back.
Yeah, and like for example, well, Anna, literally Dr. Katie just did lip and tongue tie on her like 30 minutes ago. And she's 5 weeks old today. She was gaining weight perfectly. I mean, and she latched wonderfully. I wasn't having any pain. She was gaining so much weight, I didn't even have to go to my first pediatrician visit. And of course, you know, they weren't very concerned because she was gaining weight very well, and she was latching really well, but she was definitely, and as she's getting a little older, she's very gassy. I could tell looking at the structures, and because I know the anatomy, you know, I can tell she's restricted and tight. I have a lot of milk, and she was getting milk, and she was doing fine, you know, from that sense. But also because we know the implications for, like Dr. Katie was explaining when it comes to development of the nervous system and all these things, but also with growth and development of the jaws, you know, and over time, and it can be genetic. And my husband had a tongue tie growing up. He had orthodontics for 7 years. He developed obstructive sleep apnea as an adult, you know, and I know he hates me telling everyone that. But those are real things that, you know, happen as an adult. And when you are catching things early, it's always good to treat it early, because babies do really well. They heal really well. And they have their whole life to grow. Whereas like on an adult, you know, you can do it and treat it, but it's not necessarily going to impact the growth and development of the palate, and therefore the mandible, and all these other things that are actually
and also like important. The vagal tone too. So you know, treating it early is always better.
What's the oldest you'll do a kiddo? Like,
we say up to age 18, and a lot of times
will do a tie stuff.
Up to 18.
Up to
But will
18.
you cut, like if you saw a tongue tie, lip tie, anything on an 18-year-old, would you cut
On
it?
a 2-year-old?
On an 18-year-old.
On an 18-year-old. You know, we've definitely still recommended, but it's also based on, you know, the individual patient, like what's going on with them. You know, it's interesting, like Dr. Stephanie says, treating the lip, tongue, cheek ties early is always just better, because the infants do the best. But we're also thinking about, even as a toddler, and speech development is huge. And we see a lot of kids going, you know, seeing a speech pathologist or an occupational therapist, working on that tongue movement, and they notice the tongue is very restricted still, and they're having trouble making certain speech sounds. And that's when we get involved, and we're able to do the procedure. And you know,
and some kids at that age, even like around age 1, when kids are starting to eat more solid foods, we'll see kids that are in feeding therapy or having swallowing issues. And a lot of the kids, you know, too, with special healthcare needs will present with that. And it's just amazing how treating it, even when you think it might be minor, can just have a huge benefit, you know. And we've seen a lot of kids graduate from feeding therapy or speech therapy, you know, so you're never necessarily too old.
you know, a lot of times
for a
we
benefit.
hear, you know, we hear, oh, it's just a minor tongue tie,
the growth and
or
development as much.
you know, it's just a minor tongue tie. It's really little.
Or we hear all the time, like, oh, they said at the hospital they don't have one. And I'm like, well, they're not trained to look at it like you guys are. So that's why I always recommend.
We're evaluating the anatomy, but we're also evaluating the functional movement of the tongue. And, you know, I think as pediatric dentists, we do have a lot more training and experience on understanding, like, tongue movement. And where the tongue should be positioned, how it should even look like when it's just resting in the mouth.
Where the tissue, the frenum tissue should be attached on the bone. You know, there's different classifications, you know, obviously, but we know what we're looking for or how tight, you know, how much tension there is when you're pulling on it, you know, and how does the tissue blanch when you're looking at pulling or tugging it on the bone where it's attached. So you're looking at all of these things when you're doing an oral assessment. And no, you know, providers at the hospital are not trained to look for those things. So it is good that people are aware of that. Because it doesn't necessarily mean yes or no, you know, really until you've had someone who specializes in diagnosing it and treating it, you know, that's what you really,
Because, a tongue tie is going to be so individual for every person and their own anatomy and their own function, you know. Every tongue tie is different, and how it affects that person is very individual as well. So, like, of course we want to catch it early, but we still want to make sure we're helping kids at any age, because we also want to prevent, you know, issues with growth and development. Like, I love when I meet a child and we're still, they're still at a great age where they haven't had these growth spurts, we go through with our jaw development and growth, and that's only going to help them in the long run with orthodontic care, because a lot of parents are still interested in that in the future.
And that's, aesthetic a lot of times, but, treating it early before the permanent teeth erupt can be really beneficial, and using like a CO2 laser like we do doesn't cause scar tissue, so you can do it early. It used to be when the technology wasn't as good that you would potentially wait until kids were, the space was kind of closed between the teeth with that lip tie, and then you would treat it before the braces came off, for things like that. But with newer technology, we're able to do it sooner, but again, it's never too late, and a lot of times we are doing it on older kids that are in orthodontic treatment, referred from an orthodontist too. So there's a lot of different reasons. And again, that's not necessarily impacting function, but it is an aesthetic thing because the tissue will cause a large gap or diastema between the two front teeth. And so that's another reason, for that lip tie. But the lip can also, like Dr. Katie said, at a young age, you see it potentially affecting the seal of latch when mom is nursing. So a lot of times we see it's in toddlers. They don't want to brush their teeth, or they'll complain it hurts, or the tissue will bleed, and they're more likely to get cavities. So we'll see a lot of kids that have really thick lip ties are just more prone to getting cavities between those.
It's harder to brush, and there's a lot of extra tissue there, so the plaque just kind of hangs out up there. So we'll see cavities
constantly traumatizing
most often.
the tissue when they're brushing, which is not good. Or like some kids as they get older, and my husband, like I told you, had a lip tie. He wasn't able to wear a mouth guard, so he was constantly traumatizing the tissue, trying to put in a mouth guard, and it would bleed over and over. And now he's got jagged tissue, and it did cause scar tissue, and it didn't heal well. So using the CO2 laser is a lot better than what a lot of providers will say. Oh, well, they might fall and it'll tear on its own.
My favorite
thing, like crazy, and it will cause scar tissue.
They'll grow out of it. That's what I hear about. Like, do you grow out of your fingers and toes? Like, no, it's part of your body.
Extra tissue.
Sometimes the tissue recedes slightly, but you don't. And when it's really thick like that, it is better to treat it early and to treat it with a laser as opposed to waiting for a child to tear out.
And that's
play sports.
I mean, with the type of laser we're using, that's why we're able to do it so safely for infants. It cauterizes the tissue. It dramatically reduces post-op discomfort, very minimal.
Well, you can see she's so chill. She just
it's
not like she's traumatized.
Usually they're just like tired and sleepy.
And just like kids,
I think parents are worried about.
They don't always want to be like swaddled, or they don't like it when you put them in their car seat or change their diaper. They don't like those things necessarily. The procedure itself, though, using the laser, it has a numbing effect on the tissue. So the procedure itself, we don't even have to use a local anesthetic or numb a baby. Because the laser itself, how it works, kind of, and it's super quick and easy. And,
the procedure only takes a few minutes. It's really cool, and we don't have to cut the tissue or do stitches.
Well, you do it the same day as consult.
We do.
Okay, that's what I tell patients.
So many babies, they've already seen someone like you, and the parents are more prepared for the procedure, and we're able to do typically treatment that same day if the parents want to, and. We kind of have it just built in our schedule that way because it's kind of hard to get out of the house with the baby.
And I think
we want to make it as convenient as possible.
The baby's having enough symptoms that most parents are ready to, take care of it, and
I mean, by the time a baby ends up in our office, we're like the last line.
They've seen someone else,
they've seen a few other specialists. And finally, someone was like, "No, you need to go see these people."
And you don't necessarily need a referral though either. We are always evaluating all the structures in the mouth that child each child's regular routine visits too, or some parents. They don't know and they have questions, and I always say it's better to ask and come in, and we're happy to help and evaluate too.
Well, thank you so much. Anything else you guys want to get out into the world of the Facebook world? Yeah, you guys did great. So,
I think my best advice for parents is keep asking questions. If something doesn't feel right, someone is able to help you. So it always breaks my heart when moms we see them way later in the game,
Right.
and they've stopped breastfeeding even though they wanted to.
Yes.
Yeah.
And we do hear that a lot.
Yeah.
And if you,
so-
honestly, I feel like it's because they're like, well, they were at the hospital.
Yes.
Yeah.
A
Yeah.
lot
They
of
didn't
people
have
are
one.
told they
Yeah.
didn't
Yeah.
have a tongue tie, a lip tie, a buckle
Yeah.
ties, or someone wasn't even necessarily aware of how to, assess or
Right.
or educate. But we hear the story every day.
Every
and
day.
It is
Yeah.
sad.
Yeah. Oh,
That's why
really?
it's just
Like
keep
a
asking
husband.
questions, and
Yeah.
we just want to be there to help parents reach their goals.
Yeah.
Yep.
All right.
So.
Awesome. Well, thank you so much for doing this.
Yeah, thank you guys.
Appreciate it.
Yeah.
We can only tell people so much.
Well,
Right.
the
Right.
more we talk about it, the more I think you don't always think about everything.
Yeah.
That people ask questions about or wonder about. 'Cause
Yeah.
for us, it's like,
Part of
now
it.
we just
Yeah.
know.
Yeah.
So,
Yeah. And it's part of your daily life.
It's
so
good to
yeah.
ask
Uh-huh.
questions, I think. And,
Cool.
yeah.
All right. Well, thank you,
Awesome.
ladies.
Thanks, guys.
See you soon. Bye.